Welcome to Breaking with Tradition, a new Catalyst podcast where we follow in the footsteps of our founder, Felice Schwartz, and sit down with change-making leaders and professionals accelerating diversity, equity, and inclusion in today's global workplace.
Founded in 1962, Catalyst drives change with unparalleled thought leadership, actionable solutions, and a galvanized community of multinational corporations to accelerate and advance women into leadership. Because progress for women is progress for everyone. We're your hosts. My name is Lucy Cullen.
I'm Victoria Cuquetz.
And I'm Erin Souza-Resendiz. And we're three Catalystas that live in different regions around the globe. We're united by one goal, to create workplaces where anyone can thrive.
Welcome to Breaking with Tradition. I'm your host, Erin Souza-Resendiz from Catalyst. Today, I'm so excited to be chatting with Jaqueline Oliveira-Cella. And today, we're going to talk about wellness in the workplace and what workplaces and leaders can do to support employees through benefits, no matter how they're showing up to work.
Thank you, Erin, for having me. It's a pleasure to be sharing a little bit of wisdom and exchanging and learning from the audience as well. So happy to be here.
So let's start just by hearing a little bit about you. Tell us about yourself, what you do, and what led you to focusing on this intersection of health and work, and really how you really think about wellness.
I'm Jaqueline. Right? I'm an actuary. Sometimes I joke as a recovered actuary, pension actuary, with MBAs, with a strong business background. I have worked most of my career, like my entire career, and being part of large corporations, from designing, pricing, B2B products, insured or self-insured, health, wealth, and well-being and all other benefits to employees. My journey inspired me to actually found Wellbeing Consulting, which is I provide services to health, well-being, and insurance corporations focus on redesigning of their offerings, metrics of success, and like creating a value, right, for the employers, like a value of their offerings that is ultimately impacting the health and well-being of employees. And additionally, I created, as I will tell more, and then towards the end, I created Health at Work and People, which are studies that are built in collaboration with health experts and industry leaders, with two goals. One, to serve as a self-advocacy tool for employees, and second, for their health. And second, as best practice for employers and healthcare organizations. Now, about well-being, right? I will provide my own view, so bear with me. When I think about individual well-being, here is what comes to mind. I feel good, I feel valued, I feel safe, I feel loved. And that includes well-being, my individual well-being, professional, physical, emotional, social, my mental well-being, financial, and spiritual well-being. Right? When I think about corporate well-being, let's keep it simple. And instead of saying I, we say we. So we feel good, we feel valued, we feel connected, we feel safe, we feel like we can flourish at work. And how do we achieve this? We will talk more later, but start by understanding which areas in your company you're actually missing those. Missing those feel good, feel valued, feel connected, feel safe, feel flourishing. So be curious to know more about where the gaps are and start from there. Right? Start building solutions based on what your employees are telling you.
So often, wellness in the workplace, we talk about it and see it when it's actually not there, right? So we know that burnout is one of the biggest costs to companies. It costs billions in productivity each year, right? So burnout is a symptom of a lack of this holistic wellness, right? So let's talk about what are some of the first steps that companies can take to address that at a systemic level. I love that you said we, right? Because it is actually systemic and not individual. So what can companies do as first steps to think about this and address this systemically rather than just reactively?
Burnout, as you said, is the consequence. It's what you are aiming to avoid. And why? Because that takes people off the workforce. And before doing that, it actually makes them inefficient, right? So when I think about accountability, right, we all share responsibility to transform workplaces into a thriving environment. And it begins with every single of us, especially if you have people manager responsibilities. And I would say it starts from the top. Wow. Like maybe instead of CEOs, we should have CEWOs. And going back to your questions, mainly chief executive well-being officers. um, but going back to your question, so burnout, let's start like it's a workplace issue, not an individual, not a personal issues. And symptoms include the energy depletion, right? My energy is low. I'm distancing. It's so bad. It hurts so much that I'm distancing myself from the job that I love, right? And I started being cynical about it. And then another symptom is the same tasks that reduced in efficiency, meaning I'm used to do a certain task, and now I'm taking way longer to execute the very same task. So those are symptoms. So why this is relevant? Because you don't start addressing burnout by going to the solutions. You start by understanding what are the root causes, right? Who is impacted? What are the root causes? Start perhaps with groups that are most vulnerable to burnout, including high performers, by the way, right? And understand what the challenges are. So, for instance, when you think about the healthcare industry, that has been over and over reporting very high levels of burnout. I think the last study that I put together, it was over 60%, right? And when you look down, like when you look into the details, things like excessive administration. So first you need to ask the question. So several hospitals, one of them, I believe it was the Mass General Hospital in Boston, went down to the root of not only interviewing healthcare workers, but also gathering data from different shapes and forms. So they could be informed on what's actually driving burnout. So things like excessive administrative duties, the PJ time, meaning I work extra hours to maybe enter data on a system about my patients, lack of control over their jobs, and limited patient interaction, right? So when you start looking into I would say make the box bigger. Understand as much as you can, all the different issues that could be impacting your population. And then you can start mapping what solutions, what are the key stressors and what solutions could be solving for them. So number one is it's not about just providing more salary or more benefits. It's systemic. So you do need to look into, instead of band-aid fixes, look into really deep structural changes that could really address those root causes. So if a prevalent issue for a healthcare provider is a lot of time with data entry, like I don't even look at the patient, right? When you go to a doctor, they are looking at you and looking at the computer. And the whole fee per service model, right? Where they need, like, I need to go fast, right? I have 15 minutes, 10, 15 minutes per patient. Then you start looking, okay, what can I resolve? If it's administrative tasks is one of the problems, could technology be a solution? So hospitals are testing, for example, use of voice to text, AI empowered voice to text to capture conversations with patients and have that information added straight into EHR systems. On the same token, you see more and more value-based care approach for certain situations, right? So that's like, again, it's matching the problem with the solution. And then you need to take that beautiful step back, look into your culture. How are you creating the conditions for each of the different key stakeholders to actually thrive, right? Is it sometimes you see it's ingrained, like as part of the culture, that you were rewarded, let's say, by the number of patients you were seeing. If that's your way of rewarding and has the same weight as quality of care or care outcomes, perhaps you need to rethink how how people are rewarded, but more so, are you enabling people to pause, refresh during the day? And how are you approaching, for example, training to people managers, right? And then I would say once you have your solutions prioritized, evaluated, priced, you start, perhaps particularly on a healthcare system, on a healthcare industry, you want to start small. So you test pilots, see if it's working. And when I think about designing solutions, it's key that employees impacted by the problems are part of designing the solutions.
It begins with fact finding and asking questions. And how do you find that information? It's from the individual people who are experiencing this. So they need to be part of the solution development too.
Measure the results. Measure that what's working. Measure what's working, what's not working. Understand the why, and do it again. I would say treat little small failures as an opportunity to learn, as opposed to something that is bad, right? Actually, some learn more through failure than just checking the box. And then I think when I mentioned about people managers, and that's like, if there is one thing to change in the way that we are working today, is can we retrain our people managers from the CEO to all levels of the company? People don't leave companies, people leave people. Compensation, give or take, align it. You see over and over studies showing that people are leaving in part, like due to relationship with their managers.
And I love the point about upskilling. How can organizations make sure managers are getting that upskilling and helping to foster the culture of trust and flexibility and care? a manager understanding their employees' individual needs, what's going on with them, how they're showing up, it seems that they can be the conduit to making sure organizations can personalize employee benefits, right? So it's not a one-size-fits-all approach. And I'm curious if you could share a little bit about your take on, how can organizations make sure that their benefits are not one size fit all, but actually are, personalized and are meeting people where they're at, and how they're showing up with their intersecting identities, especially marginalized employees.
I love the question because it's a great chunk of my entire career was focusing on developing employee benefits. The interesting thing is, over time, it's like you develop silos of like benefits. You have retirement, you have healthcare, you have different types of insurance, and all of that are solutions that address employees' issues that should be that employers that are not covered by the government and employers are stepping in, right? So always, I would say, in terms of personalizing and watching for marginalized groups, always start with curiosity. One of the models that I have been able to develop over time is create, if you are designing that offering, if you are responsible to design that offering, you start with capture the voice of the employee. Surveys, conjoint analysis, interview with employees, understand all the issues and how it's impacting your employees. Then build the voice of the business. What are the best practices? What are market trends? Like how this particular industry is evolving, right? My talent, so how I compete for talent. Then the third, which is the voice of the business. So voice of the people, voice of the market, voice of the business, looking into affordability, sustainability, alignment between the employee benefits and values, right? And giving, when I think about specific examples, take caregivers, which is the majority of employees are caregivers. And more so, 1 in 5, so getting to the more complex situation, caregivers that are caring for their parents, they may be also caring for their children, and sometimes parents-in-law. And I would say if you're lucky enough to have them in your life, and imagine a situation where one of the individuals that I'm caring for happen to have a disability, right? So let's start with the more complex. What does it mean to us? It means that I could have, and this is real, right? I could have a father. So let me take one step back. Look into what are the roadblocks that are taking them away from having their mind at work. And if there is an opportunity for employers to act, do so. So consider a father, and this is a real situation, that's spending hours to actually find a healthcare provider for their child. Once they found, like hours to find, hours to schedule that appointment, and then struggling with high deductible plans that sometimes, like, I don't know if you have seen that research from the Commonwealth Fund, 30% of employees cannot afford like paying for their own care. And now you need to, once you get the help and there is a treatment, now you need to find to fight sometimes with insurance companies and payers because your claim has been declined. So more time, more energy.
So much hoop jumping, and
Correct.
and so much of that is likely invisible to your employer. They don't know all the
That's it.
details of
Because
your lived situation.
I was astonished to see like being a caregiver myself. I was really surprised when I saw the stats. 1 in 5 of our employees could be caring for a child with a disability. So you are not alone. It doesn't mean that you're going to shout to the four corners of your office that all the problems you have. And that's the silent struggle, right? Because you try to be your best self at work and separate things. But unfortunately, things sometimes cannot be separate. Then it comes, you have a people manager that you can trust. And you can have an open dialogue and figure out a solution together. That solution could be flexibility if your job warrants for it, or perhaps switching the type of job you have, if that's again, it's available to you. Things like if you are spending all this time, measure first, you are spending all this time with help to find the right care and to coordinate the care, why not use your healthcare provider, and they say to serve as an advocate, like to have healthcare advocates as part of the program, right? Be curious about that. And there are companies that can actually do care coordination for complex situations, for complex care. Um, and securing healthcare is just the start, right? When you think about the financial impact, when I was researching the impact for caregivers to be responsible to care for a child with disabilities, it can be up to 10 times more expensive than raising a typical child. It's not just about money, it's mental energy, the well-being, and without support, what happens? They get knocked out of the workforce and then more financial strains. And while employers may not be responsible for it, they will be suffering with the ripple effects of it. So things like how to solve for it, bringing the glass half full, right? Considering that 42% of employees turnover could be avoidable, why not looking into if it's a financial strain, looking to a child disability insurance. There is innovation on the market. Emergency funds. I mentioned flexibility, which goes hand in hand with culture, with like promoting well-being, and training managers. So those are the things that like you can add financial coaching, support with legal matters, legal assistance programs. The list can go on. But just for the sake of this conversation, but start with curiosity, look into problems to solve in health, wealth, and well-being, and start crafting solutions that can be affordable, sustainable, and align with your corporation.
The example of caregivers is a great one because it's emblematic of some of the intersecting ways people show up. Disproportionately affects women. They're disproportionately caregiving for children, and it allows us to think about how we can personalize benefits based on those lived experiences. So, great example. And so let's as we close this conversation, let's think ahead to the future. I'm curious how you envision the evolution of wellness programs and benefit packages in the workplace. What might a truly supportive workplace look like in 5-10 years?
So wishful thinking, right? Forward thinking and wishful thinking mixed here. So I would see with AI, right, coming, and keep in mind, AI is the same. I treat AI the same way that internet many years ago, or Microsoft Office, and like tools. AI is a tool, but with the evolution of all those new technologies comes the opportunity for us to simplify access, to personalize care, to bring more curiosity, right? Not everything is about data, but start like I'm an actuary, right? So it's like I'm biased. I believe that if you are taking time to understand what the issues are and measuring the impact, there is a higher likelihood that if you are developing, like if you're responsible for developing employee benefits packages or total rewards packaging or the entire HR, right? The offerings that are given to employees, I think you will be way more successful if you are measuring the issue and how the different solutions are helping you to address that. So more curiosity, simplicity, and personalization. The number one action that I would love to see more and more is let's understand and train people managers. They are sandwiched in several instances. They are in that beautiful like space between business pressure and asks from employees. So you need to provide them with the training and with the space to succeed, right? And be rewarded as such. So I would heavily focus on that. And when I think about the workplace so I would also see more proactive healthcare. For example, if you look at data claims, like medical claims or RX claims, you will see that there are two stats that come to mind. 5% of the population that are heavy utilizers are driving over 50% of the costs. And why I mention that? Because companies are eagerly trying to mitigate medical inflation. The other stat is 80% of the population, 20% of the population impacting, creating 80% of the medical costs. So if you understand the underlying causes of the 20% or the 5%, you have an act on that. So let's say if it's obesity or diabetes or cardiovascular diseases, move away from the eat your broccoli type of conversation and really build programs, right? The whole conversation with GLP-1s, it's not about just providing medicine. Like food is medicine is real, relationship is medicine is real. So build systems that you can actually look at mind and body and effectively impact those employees. So number one, they don't become as severely sick, right? And saying differently, they are healthier, they feel good, they feel valued, right? They feel cared for, and they are well connected. They are flourishing. They have the support needed, the clear guidelines, transparency. They have the support needed to flourish. So that leads me, again, I will repeat that ways of working should be incorporated, like well-being should be part of ways of working. It should be part of how companies structure their business, how companies structure rewards to employees, how companies work.
This has been such a rich and thoughtful discussion. So appreciate the time. Thanks for joining us today, Jaqueline.
If you like what you heard today, be sure to subscribe to our podcast wherever you listen, watch on YouTube, or find us on catalyst.org/podcast.